Hello, welcome to the Bonadio Group's Healthcare in Focus segment. I am Jonathan Miller, co-practice lead in our health system and hospital sector and partner at the Bonadio Group. And today I'm joined by Jess LeDonne, an attorney and director of policy and legislative affairs here at the Bonadio Group. Jess, you joined our firm about 6 months ago. Can you give us a brief overview of yourself and the role?
Yeah, absolutely. Thanks, John. I've been with the firm about 6 months. It's been really wonderful. I'm happy to be in the role and be back in Rochester. I'm a Rochester native, so happy to be back after living across the country. I'm an attorney. I'm barred in New Jersey and Pennsylvania, like you mentioned. I started my career in public health policy and transitioned from there into Affordable Care Act compliance. So I worked in ACA compliance for multi-employer funds and for corporate clients for many years. And thereafter went to kind of a broader tax incentive role, again with large corporate clients. So most recently, I was working in tax consultation in that role and with a government relations focus. So quite a bit of lobbying at the federal level for those tax incentives to continue that our clients relied on. So basically, my career has been kind of compliance and consulting focused in highly regulated areas, healthcare, tax, those spaces. So in joining the firm, the hope is that I am going to be a firm-wide resource across all of our practice areas to really help with, anything that is changing in the legislative landscape, which happens all the time, and just keeping an eye on that for our work and our clients' industries to make sure we, as a firm, and our clients feel fully informed, knowledgeable, ready to continue to be compliant and to also take up advantage of new opportunities that arise in new legislation. So that's the role. It's been really great start 6 months, and I'm happy to be doing this with you today. Thanks.
Well, welcome aboard. So
Thank
that
you.
role is specifically related to what we're talking about today, legislative affairs, and it's timely in New York State with the budget passing on May 2nd. So apart from the main area of focuses, really what we saw in our healthcare practice was a discussion of the Medicaid rate increases and not getting it to necessarily where they advocated for. But what we kind of do is when we look at the budget, we do rely on a lot of their advocacy groups and the great key summaries you provide. And we learn from that and we discuss with the clients and we kind of wait for a 45-day period just to see where the questions are coming and what initiatives the clients are considering. And that's why we're coming out with this today. So some topics of interest related to the budget is the expansion of really two large funding programs, which is the state vital access provider, and then as well, kind of tied to that is the vital access provider insurance program, as well as the statewide healthcare facility transformation grant program 5. And then also we found of interest the 340B program. So Jess, can you shed some light on those topics?
Yeah, these are really great topics. I'm glad we're talking about this. Like you said, when the budget initially is released, we get the main headlines for kind of the big items that catch everyone's attention. But some of these other programs, the ones you mentioned, some programs that maybe have been around for years, but have some expansions or adjustments in the budget. I'm glad we're talking about those because they might not get as much attention, but I think they're still really important for our clients to be aware of. So one that you mentioned specifically, the statewide healthcare facility transformation program 5. So it's iteration 5. It's been around for years, but the budget has injected about $900 million of additional capital funding into that program. So there are some earmarks in that funding for kind of specific types of programs, but the intention is to help with big transformational programs, so debt retirement, big capital projects. So it's really quite broad. It can cover quite a few kinds of projects. And I know we've had clients use this in the past, but I think with this new injection of funding, it's really important to highlight it today and have our clients kind of take a second look at some opportunities that might be there.
Yep, I've had a few clients that have in the past been awarded the Transformation Grant Program. I've also helped many clients over the years apply for the Transformation Grant Program. And in round 3, was very fortunate to have one client continue to apply. Persistence paid off. The other
Mhm.
program I did mention was really on the operational side, the VAP and the VAP app program. So I think what's important to remember is when we talk about these programs, VAP and VAP app, that's operational. Transformation, that's really capital program, that's capital. VAP and VAP app, can't use capital, you can't use capital dollars. Transformation is not to support operations, so you bifurcate those. Over the years, I've worked with many providers on the VAP and the VAP app programs. One key distinction, so everyone's clear what we're talking about, is the VAP program is funded in partnership with federal CMS, whereas the VAP app program is actually funded all with state dollars. And so both of these programs I've assisted clients with over the years. One of the things we're looking at right now is I'm getting questions from my client base is when is the funding going to come out? Or they've approved this, or they've kind of said it's in queue. We're looking at it. What's going on? I believe what this relates to currently is New York State Department of Health is currently negotiating with federal CMS the upper payment limit. Without going deep diving in a lot of those technical terms, they're negotiating that with a UPL. And once that UPL negotiation is done, we'll start to see the discussion and the approval of the VAP funds, and hopefully those monies start flowing. And then hopefully after that, we'll start seeing more of a focus back, especially on the nursing home side, to the VAP app programs. Jess, are you seeing anything else kind of related to these programs with undispersed funds, or did the state budget do anything to maybe support the infrastructure of getting some of these funds to flow a little bit quicker?
Yeah, it would be nice if it had kind of directly had some process improvements like that. I know you mentioned kind of frustrations with the application process or undispersed funds that we've seen historically for some of these types of programs. I mean, the short answer is no, the budget didn't directly address those process issues. And I know VAP and VAP app have just Excel applications. So that's still the way it goes there. I know the statewide facility program that does have an electronic application, so a bit better. But the hope is with some of this new funding that some of that will go to process improvement. So we'll see hopefully quicker turnaround, quicker response time on applications, and just more dispersed funds. We've seen funds sit undispersed, and so hopefully that gets turned around with some of this increased funding as well.
Yep, and the last point I'll make on any of these programs is even if you're considering applying for it or learning about it and talking about it, what I always say is the best thing you can do is start to formalize that consideration, start to think about your strategy, start to think about maybe operationally what you might need or capital what you might need. Start thinking about what your organization's story is, who you serve, how you serve them, and what would happen if you weren't there. Then also think about what are you going to do to transform and what are you going to look like after the grant periods on these awards. So Jess, kind of switching gears, the other item we found of interest is the 340B. Can you talk about that a little bit more?
Yeah, definitely. So that is another one that I had hoped would be kind of more directly addressed in the budget, but essentially to kind of just zoom out for a second. So the 340B, that's a federal drug manufacturer program that basically is saying if you're participating in Medicaid and you're providing outpatient drugs to eligible providers, it's going to be at a reduced price. NYRX, it's a fee for service pharmacy benefit program at the state level. So, providers that are transitioning into that program that also participate in 340B have been eyeing this potential revenue loss, this unintended consequence of the interplay of those two programs causing some losses. So, I know this is something that was considered in the budget. Governor Hochul had basically even highlighted the fact that some of the funding, I think it's about 700 million of the dollars in the budget, were intended to help ensure that the providers that are transitioning into that NYRX program aren't as negatively impacted by that transition. So it's kind of a more direct funding to eligible clinics, providers, and treatment centers. Obviously, great, direct funding is great, and it's helpful, and it will hopefully help mitigate some of those unintended consequences. Certainly not the kind of more direct and targeted solution that we had hoped to see, but still helpful and something for clients to consider if they are one of the providers impacted by those unintended consequences.
Yep, and as you talked about those unintended consequences, what I've seen throughout my career is anytime there's a change in policy and funding streams, there's always a transition period, which can
Mhm.
often be bumpy and lead to some of those negative effects. What I would recommend is continue to educate yourself on it. Talk to your advocacy groups, talk to your peer institution or your peer organizations,
Mhm.
understand what they're doing related to it and how they're reacting.
Mhm.
So I hope you found today informative and helpful. If you have any questions, as always, feel free to reach out. So thank you very much.
Thank you.